only had the virus for one day of a high fever, which I got on the plane after leaving the Diamond Princess. And then that spiked, lasted about 8-9 hours, and that was it. There's no antibiotics that were given me because none exist. So I've been having a diet of Gatorade and regular food, just trying to stay hydrated.
1 year ago, at the very beginning of this crisis, one of the passengers infected on the Diamond Princess cruise ship joined me while he was in quarantine and sick with COVID, Carl Goldman, who you just saw right there. And the other passengers on that ship were some of the first known cases of COVID-19 outside of Europe and China. At the time, he told me he was fine. It was a mild case and he was recovering well at a hospital in Nebraska. Unfortunately, though, that was about the best he felt. Since last March, Carl says he has been plagued by the lingering impacts of COVID and other health problems, and he's been in and out of hospitals trying to figure out why. Back with me now, 1 year later, is Carl Goldman. Carl, it's great to have you back. I'm so sorry that you're still feeling the after effects of this. Tell me what you've been going through.
Thanks, Katie. It's hard to believe it's been a year since we last spoke, but since then, as you've said, I've been in hospitals more than I've been out of hospitals. I had the start of what the doctors thought was Guillain-Barré syndrome, which affects the nerves on the hands and feet, a couple months prior to getting COVID. My body did a great job of fighting COVID, but then the Guillain-Barré took off, and as the doctors tried to treat it with all traditional treatments throughout the late spring, early summer, I reacted negatively rather than positively. I got worse rather than better. And so they thought it was a cocktail mix, or maybe a cocktail mix of the aftermath of COVID, because I had all the symptoms of a long hauler along with the Guillain-Barré. So it was a mixture. I then spent a good chunk of the fall running every single test in the world, medical test in the world. Came out the positive side of it as I came out negative. So nothing life-threatening, no tumors, nothing. But I'm an enigma. The doctors cannot figure out what the heck I've got.
And just looking at the video of you walking, my heart reaches out for you having to go through this. I mean, given that you had COVID, when they talk to you about that, I mean, what do they tell you about the research they're doing about long haulers like yourself?
Well, they're doing lots of research, and it's come out a variety of ways, including the fact that I probably don't need a vaccine. The people who've had COVID, they now are showing that you have what's called B cells, B like in boy. And the B cells, even though the antibodies wear off over time, the B cells permanently store the memory to rebuild antibodies the second the virus reattacks the body. So that's a good sign. But as far as them understanding what's causing me to have extreme neuropathy, not be able to walk, I am stuck in a wheelchair, but I'm alive and I'm healthy, and I'm healthy in terms of being able to be awake all day, read, do a little work on the computer, although I only have use of one finger now, so it's very frustrating to type pecking with one finger. Thank goodness for voice control, right, Katie?
Yeah. Well, what's your message to those out there who don't think this virus is a big deal?
Well, it can be a big deal, and we are down, as we see more and more people get vaccines now and having things open up, which is a good thing. We don't know what the long-term effects are of this. I didn't start seeing the damage that COVID had till a good 4 months after I had the virus and it was March 16th when I tested negative after having it for 29 days. And so my message is be cautious, be smart about it. Yeah. And then if you do end up having a problem, look at it, as I said before, of making lemonade out of lemons. I mean, I'm in a wheelchair, but I have a lot to be thankful for. Although I am bummed out because, we own the local radio station here in Santa Clarita, and about a week ago, someone hijacked our Facebook page, the KHTS Radio Facebook page, and they took all 66,000 of our followers. So we're starting from scratch all over again. Other than that, it's been, my wife's been incredible. She's an angel. She's the one running the station now because we're both hands-on workers and I can't do that anymore. And she's taking care of me. So she has a giant load on her shoulders. She was in a cesspool of COVID with not just me, but our friends and, of course, the Diamond Princess. And then when we were in Omaha and on the plane that was rescued, that we had rescued back to us, and she never got COVID, which is remarkable. As they've tested her blood,
Amazing.
they found that the T cells seem to be killing off the virus in her body. But she's also an enigma, even though she's extremely healthy. Doctors have no idea, and the researchers have no idea why her T cells resist the virus in such a way.
Thank you.
Thank you.
Thank you.
Thank you very much.
Thank all of you out there.
Thank you as always.
Thanks to at home.
Thanks for watching.
Thank you so much for letting us into your homes during these extraordinary times.